Let's bring in right now NBC News' Kelly O'Donnell.
Yeah.
She was at the press conference yesterday in the White House. Kelly, we're asking, of course, questions about these tests. They continued. The White House tried to answer some of the questions about the tests, but bottom line, why didn't we get the World Health Organization tests? I understand that they said, oh, they don't reach our standards. Well, they certainly reach the South Korean standards and help them bend that curve. Why can't we get some of those to supplement our lack of testing? Why can't individual states do the same thing?
Well, part of what we're all learning, Joe, are some of the bureaucratic steps that are involved in this. We have asked at a couple of these briefings about the World Health Organization test, and the most fulsome answer we've had so far came yesterday. The president stepped aside from the lectern, and he let Admiral Giroux and Dr. Birx, two of the experts on the front line of this, Admiral Giroux in charge of testing now, and their answer to this is that the World Health Organization provided an early stage test that had not met FDA approval for quality, and it was different methodology, and they said flat out there wasn't a ready test offered to the United States that was turned down. Now, we have to do more work on this to find out some of the distinctions there, and they are saying that there was never a time that they were given something that was ready for use in the field that they turned down. So we'll have to continue to ask those questions and point that out. And when you talk about
Kelly, that's fascinating, because obviously it was good enough for South Korea. It was good enough for these other countries, Singapore, who tested.
It was ready for them.
And actually,
well, as you know, the United States
radically.
does not. The United States on pharmaceuticals and on testing does not allow for what other nations do, just as a matter of course. I mean, you know that from your time in office, the whole issue of different pricing for over-the-counter drugs as well as prescription drugs. So that's their answer. Now, I can only tell you what they told us.
No, I understand that.
Yes. I'm certainly not a scientist.
I understand. I understand. It's just bizarre that they would think that in the middle of a pandemic. And of course, that's not for you to answer. I understand that completely. We'll discuss that around the table. Let me ask the next question then. When is every American that needs to get tested, when are they going to be able to get tested? Because we were promised that several weeks ago. It hasn't happened. When does the White House say every American that wants to be tested can be tested?
And we don't have a clear answer on that, and we've been asking that day to day.
And what's their excuse for not being able to answer that basic question?
And again, what they're telling us is that the different levels of approval that are releasing these tests have happened as recently as Friday, so today is Wednesday, and that the private laboratories that have now been given the go-ahead are doing their testing. There is testing that they say exists that was before this new wave, and about 2 million tests, they say, will be made available, with the caveat, of course, that they're saying not every American who wishes a test for screening purposes could have one. It's about symptoms and a doctor saying that you need the test. One of the other lags is this notion of a website to help funnel people who can answer questions about what their symptoms are and can be directed to locations that will have drive-through testing. We don't have that yet. Testing, Joe, is certainly one of the prime questions we're asking each day because it is of such high concern, and it does help to shape where we understand the illness is in order to try to also get compliance from Americans on whether it is a stay-at-home policy, a limit your contact, a don't go to restaurants, all the things we've been hearing. And one of the questions has been, can we trust the information we're getting? Some of that is, are they being truthful? Some of it is the bureaucracy that in any crisis has its hiccups. And in some cases, we're talking about new partnerships, new technology, new tests and tools. At a time of shortages, where you have the vice president asking construction firms to donate masks, and you have different manufacturers saying we're ready to plus up on production if we get a specific order. So there's a lot of struggle for those of us who are trying to hold the administration to account, as well as to give them a venue to talk about what message they have to the American people. And this is difficult stuff to weed through each day.
No doubt about it, Kelly, but you do an incredible job. Thank you so much for being with us this morning. It's really been helpful. We appreciate it. Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.